That's something that's just not provided in these other two books in any sensible way. So that's why we made our book, so that you can really drill yourself when you know what you need to work on. Okay, so before starting prep, really important to take a diagnostic exam. We give those out at our offices. We also give them to students online. That's important because you can understand where you are and understand where your score sits at this very moment. And that can help you, move on to the next point, which is setting goals. That helps you set a goal score and, give you some sort of goal to shoot for, and you can, come up with a plan to get you there. So say you had a 1200 on your practice SAT and you wanted to get a 1400, well, you would be able to figure out a plan that would get you there rather than maybe a different plan if you had a 1200 and you wanted to get to a 1300. You can maybe engage in a different type of preparation. Maybe you won't need as much preparation or something like that. But it's really important to set those goals and come up with kind of a plan that will get you where you want to be. And once again, cramming, not necessarily the best idea on a standardized test. Psychologically, starting early and not cramming usually leads to much better success on these exams. Okay, so diagnostic. Why is this important? You can see here from this Venn diagram that there are many differences between the SAT and ACT. Many more differences than similarities. So for the SAT, you have a slower pace. You have a totally different scaled score. You have two math sections, hugely important, 50% math on the SAT, and I'm going to show you that in a diagram later. 25% math on the ACT. And then also you have more science-based questions in the ACT, an entire section of them, rather than just a science-based reading question or two or a passage in the SAT. A couple of similarities. You have one reading and one writing section, grammar section on each test, and no wrong answer penalty. So you no longer have to worry about getting any negative points, and that the essay score is reported separately, meaning that when you write your essay, that is not included in your scaled score of 400 to 1600 or 1 to 36. So definitely some similarities, but the differences are substantial, mainly the pacing and the amount of math. As you can see here on the ACT section distribution, you have 25% of the test for each section. So you have science, reading comp, math, grammar. Very important to understand that, because if you are maybe more of a math student, you'll be looking at the next slide, which is the SAT, and you have half math. So looking at those two slides, you can see that the amount of math greatly increases from SAT to ACT, which is great for a lot of students, and to choose one test or the other based on how well they do in math and how much math they want to do. So really, really important to consider all of that. And that's really where an expert comes in. So an expert like someone at Curvebreakers like myself, we can look at a student's diagnostic score report, and we can say, based on a variety of factors, that would be a much longer-winded discussion than this, a student should take the SAT or the ACT based on their skills. Another huge one is the distribution of the math. As you can see here on the SAT, which is the darker blue bar graph, you have a large number of algebra questions and less geometry and less trigonometry, whereas on the ACT, it's a little bit more even between algebra and geometry, and you have more trigonometry than on the SAT. So if you do not like algebra, you probably don't want to do the SAT. And this is something that is useful information, but is even more useful when coupled with a diagnostic report. As I said before, the timing, really important. So you can see here on the SAT, you just have much more time per question.